Hey, it's Dr. Jeff Durgin here. I'm about 56 hours into my 72-hour shift, and I know I'm looking a little bit rough. I was up and down all night last night. But I wanted to show you our main room here. This is our trauma room where we do codes, traumas, things like that. A lot of people don't get to go into ERs and look around. So this is the main trauma/code room in the ER here. We have a crash cart that has all the life-saving medications in it, like epinephrine, sodium bicarb. That's the AED. We put that on with the paddles to shock the patient when we need. These little blue things are magnets in case they have a pacemaker. We put it over the chest to turn the pacemaker off. In the cabinets up here we have intubation supplies. Intubation is when you put a breathing tube down when the patient can't breathe for themselves. You have to put a special scope in their mouth to find their airway and then slide the tube down in. We also have a central line kit, which is a big IV in case they need fluid or blood really fast. We have a thoracostomy tray, that's a chest tube. If they've punctured their lung or have blood in their chest, sometimes we have to put a tube in between the ribs to suck the air and blood out. But it's fully stocked. We use it more than you'd think. This is a rural ER where people sometimes walk in and they are pretty much dying, or their family brings them in, or the ambulance brings them in, and they're in what we call extreme condition, and they need to be immediately attended to and resuscitated. So it gets pretty exciting, especially when there's only one doctor, and if I can't save them, then there's nobody else around for backup. Here's a follow-up to my 72-hour ER shift. I have 4 hours and 39 minutes left in my shift. The phone just rang and I had to go down the hallway and check on a patient that I admitted Friday. She was admitted with respiratory failure and was a DNR. That means do not resuscitate. That means if something happens, if her heart were to stop, no heroic measures would be undertaken. Normally, if a patient passes away in the hospital, we resuscitate them. We push drugs, epinephrine, we start CPR immediately, we put a breathing tube in, we put pads on their chest and analyze to see if there's a rhythm that needs to be shocked. There's certain rhythms like ventricular fibrillation or ventricular tachycardia that need electricity to bring the patient back. But this patient had signed a waiver saying she did not want any heroic measures done. So I went down the hallway and she had stopped breathing and her heart had stopped. So I examined her, listened to her heart, checked her pulse, and I pronounced her, we call it expired. It means she died. So I pronounced the patient as deceased. Now I'm struggling a little bit to go back to sleep. Tomorrow when I get home, I'll hug my loved ones a little bit longer. Tell them I love them. Good night.